And so using Strack as the example, because we love Strack here.
Yeah, Strack's great.
Yeah. Big fans.
Definitely.
So I'm working at Strack and I twist my ankle.
Mhm.
What do I do?
So we 24/7 call center, and they would tell their supervisor, and the supervisor knows to call the call center.
Sure.
One of our licensed PAs or MDs are going to answer the phone. It's not a nurse line. So a nurse line is something where they actually have a decision tree. So back pain, yes. Is it this? Yes. Is it this? No. Go to the clinic.
I see.
We can actually take pictures, videos, make sure that we're talking with these people through FaceTime, and we're really doing a good triage on them, and we're doing what we feel like needs to be done. If it needs to go to the ER, we're going to send it to the ER.
Mm-hmm.
If it doesn't need to go to the ER and we want to see how it declares itself, maybe give it 24 hours and see how it does.
Yeah.
We'll ice it, elevate it, maybe do some over-the-counter ibuprofen.
Because like a sprained ankle, what's the ER going to do? Yeah,
No,
you
they're
sprained
not
your
going to
ankle.
do anything.
They can't do anything. Well, they can't do anything. Yeah. I mean,
they'll do an X-ray to make sure that there's no fracture. But if there's no fracture, there's just nothing they're going to do.
Yeah.
Especially within a 24-hour period. Unless it's deformed. If it's deformed, then we're going straight to the ER.
Yeah.
Yeah. So we don't ever want to compromise patient care. We always want to give most necessary care.
Yeah.
Again, a large percentage of the injuries that we have called into our call center, they're just not emergencies to where they need clinical intervention. Now, I will tell you 100% of the time, we give the employees the option of going to a clinic. We have to.
Sure.
You have to always say, if you'd like to go to a clinic, we'll get it set up 100% of the time. But I think that when you have a licensed clinician on the other end, they're a little bit more agreeable to just knowing that you're paying attention to them, that you're going to be there. They can call anytime, day or night. If it gets worse, they need to go to the ER, just have them call later and we'll set it up to where they can go directly into the ER. And even if they go into the ER, they just call us from the ER and we'll just manage it from there. So
just super nice.
However
you do it.
Yeah, the employee always has full control of what they do. And that's where we have to be neutral. We can't just be so company focused that we're only protecting the company. We can't be so patient focused that we're protecting the patient and not protecting the company.
Yeah.
So we have to be in the middle. And there's times where I have to have hard conversations with the companies and go, guys, this is necessary. It needs to go.
And that's the advantage of having essentially an outside provider rather than someone full-time working for the company, because again, you would never say that your allegiance is to the company,
right?
But having a neutral party is definitely.
Most definitely. And I think that has been very beneficial to us. If we can get our thoughts on it, our mind on these situations initially, right when they happen, then we can bring the recommendations that are necessary from a first aid standpoint to really help get it through. 98% of all the calls that we get, we're able to keep at a first aid level.